There are a variety of different recommendations for what sort of the threshold for treatment for high blood pressure. The American College of Physicians and the American Academy of Family Physicians came out with recommendations a year ago that for people over the age of 60, a blood pressure of less than 150 was a reasonable target. The American Diabetes Association also came out with their own recommendations last year, and their guidelines say less than 140/90 is what they would sort of recommend as a threshold. And then we have our American College of Cardiology guidelines where we recommend ideally a blood pressure target less than 130/80. I think one of the key things is really to recognize that these are guidelines and that a patient is a patient, meaning that we can't sort of just, and many people raise concerns about this change to actually reduce the definition of blood pressure as being high with these new recommendations. In clinical practice, that sometimes you have to have flexibility based on the patients in terms of what is an appropriate goal for these patients. So some of my older patients, we decided that less than 150 was reasonable. Some of the patients, we said less than 130 made sense. Some of the younger patients who are more active with, let's say, heart disease, where it made more sense to be aggressive. And some we decided less than 140/90. If I drive on 405 to work and I'm in a hurry, then my blood pressure is probably high. And so one of the challenges in the care of our patients is that we're trying to rush through patients, get them settled in there, check their vital signs, their medications, and we don't give them the proper amount of time to sort of get a true resting blood pressure. So in the last few months, they came up with a strategy in some of our local neighborhood clinics to try to make sure that patients who had elevated readings the first time had a second reading obtained. About 30% of the readings the second time were within sort of an acceptable or normal range.